Today I will share with you the sequence, a case that will include immediate extractions, immediate implant placement, and immediate loaded prosthetics for a double jaw case. We will start the surgical procedure with the maxilla. We have several guides over here. We have many things over here. And our backup plan is the spare dentures. These are digitally designed and digitally printed. So the first thing that we are going to do is to start with the upper jaw. Okay? So the upper jaw, we always start with it because it gives the patient a boost of confidence. So before we extract any tooth, the first thing we're going to do is to make a full reflected buccal flap. And then once the reflection has been completed, we are going to use our base guide and we are going to use a tooth index. Okay, so now they fit exactly perfect with magnetics and indices. So the first thing to do is to grab this complex, okay, and we are going to seat it on the jaw. Okay, once it is seated, now it's time to pin the base guide into the bone. If anything that impedes full seating, all you have to do is make sure your flap is fully reflected, because this guide sits passively without any undercut engagement. Now, since you pinned the base guide, it's time to extract all the teeth except the last two molars, because they will support the guide in the back. And then you do your alveoloplasty. You remove all that bone. Then it's time to place the implants. Okay? So now you go with the implant placement guide that has the timing marks for the intended system to be used in this case. We are going to use Straumann for this case. So you go seat the implant placement guide, and then you place your implants through the guide, and make sure when you torque your implants, you end up with aligning the dots on Straumann carrier with these lines, preferably buccal. You can also tweak the position with the blue lines, because the blue lines correspond to each other on the base guide and on the implant placement guide. So you have two options. You fine-tune the timing of the implants on the implant guide, or after you remove it and you visualize the implants within the bone, then you can fine-tune it with the blue marks. And now it's time to place the multi-units. You could see that we have also red marks. The red marks are to guide you where to use the screw that links the multi-unit to the implant. So this is the screw hole, 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 and this corresponds with this screw hole. Then everything is going according to plan. And now you seat your temporary cylinders for pickup after you have torqued your multi-units and insert them. You get the final prosthesis, and then you go to the carrier. The carrier has two functions. The first function is to carry the conversion prosthesis. The second function is that it has bite indices for the opposing jaw. Place your prosthesis, and if you want to proceed to the lower jaw, then all you have to do is seat it and put it aside. You leave the base guide on the upper jaw. Don't take it out. And then you go to the lower jaw. Extract all the teeth and you make a fully reflected buccal flap. Once this has been accomplished, you go get the bone reduction guide, which is the base guide, and you have the seating index that has marks that will seat on the jaw to guide you seat this basic guide. Okay, so they align to each other, and then you go and you place it on your jaw, and then you pin the base guide. Once you pin the base guide, it's time to remove the index, and then you trim all that bone. Now it's time to place the implants through the guide, Once the implants are placed, then all you gotta do is that you become ready for the conversion. I prefer you convert the lower first. How you're gonna do this case is that you're gonna go place your temporary cylinder. This case is straight multi-unit, so we don't need to bother about the timing. And then you go get the prosthesis, okay? And it has also a carrier, okay? So you see it. And then what you're gonna do is you're gonna seat it and you are ready to convert through the buccal holes. However, since the upper jaw already has the multi-units and you still did not place the temporary cylinders, you're gonna get a copy of the upper prosthesis, clear copy, you seat it. And then you ask your patient to bite, okay, for the lower pickup. And once your patient bites, then you start converting the lower prosthesis. Conversion material has been set, then you can just remove this complex and the temporary cylinders would have already been inside the prosthesis. Okay, lay it aside, and now it's time to convert the upper jaw. You go grab the clear lower hybrid, okay? You seat it into place, and then you go to you install the temporary cylinders on the upper jaw, and then you grab your prosthesis in its carrier, you seat it into place, and then you have the patient bite again on the clear carrier, clear lower, and then you convert through the buccal holes. Once this has been accomplished, you can just go tease your prosthetics out gently side to side, and now it has been converted. Lay it aside and do the same for the lower, okay? So now the surgeon installs healing caps. He begins suturing the case while you go fill any voids with resin. You leave the patient going home with pretty teeth and fixed teeth the same day. So let's say you were not able to immediately load the patient, then you have spare dentures that you can realign inside the patient's mouth, and then patient will also leave with teeth. So the whole goal is really to convert the case upper and lower at the same time with the maximum speed and efficiency. And this is just a backup, okay? So if you really would like such work, such cases, just feel free to contact me on Instagram, on our YouTube channel, on the email link in the YouTube channel, and we will be so happy to work with you, provide you with such prosthetics and such guys that I have really worked hard to develop, and I'll be so glad to make you transform your patient's smiles wherever you are in this world.